Manitobans caught in this massive backlog need hope. They need to see action, and they need to know that help is on the way.
Doctors in Manitoba say the province's throne speech may have been a missed opportunity, saying while it contained lots of reassuring language, it was lacking action, most notably in when Manitoba will address a surgical backlog of more than 135,000 procedures.
We need not only words, but we need tangible actions.
Today's throne speech detailed how removing barriers and delays to treatment patients urgently need is one of the key initiatives of the government. But Doctors Manitoba said the speech missed a critical point.
Doctors Manitoba is concerned about the lack of specifics and urgency in the throne speech. You know, on one hand, the speech was specific about hiring 20 nurses in the north, and that's great for folks in rural and northern remote communities. But there were very few specifics about how the government will clear the staggering backlog of 136,000 Manitobans. That's 10% of our population.
Dr. Thompson says he wants to see the government set a hard date to have the backlog cleared, and today Manitobans were again left without answers. Outside of the legislature, rock music and chants could be heard as members of UMFA came out in full force to send a message to the government.
A lot more listening has to be done of the frontline workers.
Among them was Dan Nagel, an assistant nursing professor at the U of M. He specializes in community health and says the stakes are incredibly high if frontline workers are not listened to moving forward.
The spillout from that is backlogs in things like surgeries, a lot of things like cancer treatments and palliative care and so forth. And it's impacting people, and it's in some cases, you know, meaning life or death situations.
The government of Manitoba says the throne speech is taking Manitoba in a new path and in a new direction where it works side by side with all in the province. But Manitoba's nurses say it rang hollow. Manitoba Nurses Union President Darlene Jackson says they want leadership that not only pledges support but follows through, as their staff shortages are reaching a critical point. Nurses are exhausted. They are tired of lip service. Promised employment for new graduates is in truth a mirage, and any nurse seeking employment with adequate qualifications is already employed. What we need now is realistic and meaningful change before our entire system collapses. While many on the front lines of the pandemic appear to have little faith, the government's plan, now laid out ahead of them, will be one they try to lay the groundwork for in the legislative session now ongoing until November 30th, with its aim a stronger, healthier, and more inclusive Manitoba. In Winnipeg, Morgan Majeski, City News.